Public records request goes ignored by the state of South Dakota until Kettleland Investigates stepped in. Now, just a week later, the data on staffed hospital beds is available to the public online. RuralOrganizing.org asked for the numbers of staffed hospital beds, staffed intensive care unit beds, and the number of ventilators in the state. When the South Dakota Department of Health did not respond to the public records request, the group's executive director reached out to me for help. Last week, I asked the state if Kettleland Media Group could obtain the same information. The following day, the Department of Health's legal counsel, Justin Williams, told me that the data was contained in numerous sources and not easily extracted, but provided it to us. Yesterday, the Department of Health began supplying that data on its website for the public to see. Today, a check of the DOH's website finds that 34% of staffed hospital beds are still available in the state, along with 40% of staffed ICU beds. The key to remember here is when it comes to planning for a surge in COVID-19 cases, what matters most isn't how many beds are available, but rather how many are actually staffed. We've heard from doctors and nurses on the front lines of the pandemic about how busy they are. This tweet from a Yankton doctor says, had another patient diverted to our ICU today. Both hospitals in Sioux Falls are overwhelmed. Same in Sioux City and Omaha.
Just having an ICU bed is not what's needed. We need to have the nurses and doctors to staff those beds. And that's something that I think is really concerning is I'm not aware of any public information that says how many doctors and nurses are needed in the state. And the state, has been needing more hospitals or more nurses and doctors for years.
RuralOrganizing.org calls itself a progressive organization for rural communities, focusing on issues like health care. This week, we sat down with two Sanford health officials and asked them about staffing needs. As we see the patient numbers increasing, do you have the personnel to keep up with everything?
Yeah, we believe we do. This gets back to a lot of the conversations that we've had since March. We are busy. We do have the personnel that we need at this point. Avera Health says it currently has enough staff to keep up with demand, issuing the following statement to Kettleland News. Staffing is a major concern with community spread. Our teams are working extremely hard, and we continue to evaluate and adjust our staffing as needed, given our surge planning levels. The South Dakota Secretary of Health says the state is aware of medical workers' concerns about being spread too thin.
We can appreciate that people have been giving their all every single day for many, many months now, and that does get tiring. But we've got some months ahead of us, and so we've got to be strong and do what we can to take care of the folks that need us.
What is the tipping point is the primary question that we should be concerned with. And, I'm not aware of any data from the state, aside from just the number of licensed beds. I'm not aware of any data from the state that is tracking when we will hit that tipping point.
According to the Kaiser Family Foundation, South Dakota has among the lowest ICU beds per capita in the country, but currently the state shows that COVID-19 cases are taking up 21% of them.